Hi, Katrina. Thank you
It,
for inviting me.
absolutely, and it's so interesting. Like the two of us met socializing at a conference, didn't we? And then one thing led to another, and here we are now having a chat.
Yeah,
So you are the CEO of a charity of Imagine Independence. For anyone listening in who might not know what you do you want to explain briefly what it is Imagine Independence does?
yeah. So we're a registered charity. We've been in existence for over 40 years. We support people with mental health needs and people on the autistic spectrum with a learning disability. We have women's services supporting women with complex mental health needs, and we do some prevention work, particularly supporting people into employment opportunities. So we work in the Northwest and we have one service in London.
Brilliant, thank you. And you've been with that organization for quite a while now, haven't you?
I have, yeah. I've been with Imagine for about 33 or 34 years, a
Wow,
long time.
lifetime. So if knowing the organization for so long, if you think about it like historically, where would you say health inequalities, health equity kind of featured in what the organization does?
Um, okay, so we've always worked with BME communities, and we've always worked with specialist BME organisations. Um, we've obviously always supported people, with mental health issues, learning disabilities, um, and our recruitment practice has been strong, with regard to valuing lived experience of people with mental health problems, predominantly, also people with physical disabilities. Sometimes we've not been as prepared as we should have been, with regard to some of the appointments that we've made, and we've strengthened up some of those systems. Um, we sometimes we've made mistakes, but they've not been intended. It's
Sure.
been out of trying to do the right thing where we've tripped up along the way. Um, I came into post. Just thinking now when I did come into post, fully as CEO for Imagine Independence. I think it was April last year. Before that, I held a joint, a co-CEO post for about 12 months. Um, I was also given the lead, the equality lead for the organisation, and felt that to be doing, becoming the equality lead for Imagine, that I needed to invest quite a lot of time in my own learning and development, as well as making sure that the organisation had the right training and knowledge, because I think um, a lot of the problems that sometimes come across my desk are out of a lack of awareness. And, I believe very much it is about raising awareness, and getting to the right place with our workforce so that they behave in the right way. And that's what I'm on a mission to do, really, is to encourage the whole organisation to be more inclusive, and to make sure that, in our screening for people coming into the organisation and from induction, that we very much look at people bringing their whole selves into work. And because we're, people that we're supporting, and their work colleagues need to be treated properly and fairly.
And it sounds like there's change coming, especially since you came on as a full-time CEO. So before that, would you say that the organization on a wider level, were they kind of like avoiding the topic or maybe just it was something really new, whereas you were saying you need to raise awareness, or is it more so that they were already following, I don't know, any relevant procedures in place, but maybe just not really enthusiastic about it and not really believing in what it all means for them in practice?
I think some of the answer is, I'm not sure. We didn't ask the right questions to know how well we were doing. I know we were meeting the obligations with regard to training, albeit at a basic level. We had an equality policy, we did bring in a consultant who worked with us to come up with a really good strategy, but some of the things within that strategy weren't followed through, some of the action points. So there was some learning from that. So she's been recommissioned now, and it's the Equality Working Party that are doing the work. And now we have just done our first ever wellbeing and equality survey. We've just got the initial feedback from that. And there's a lot for us to do. So it made difficult reading, but we can do things about what the feedback is saying. And some of the current themes I'm not surprised about really, because we have got we've got service users that are supported by Imagine, and they some of their behaviours um, uh, are difficult for staff to tolerate, and they haven't been reporting some of the abuse that they've been facing because they've been seeing it as common practice.
Right.
So there's been some racist abuse, which we were aware of, and we've been trying really hard to support the staff and support the service user. Because some of that's drawn from trauma, really. But we've just realised that within another part of the organisation, there are some staff who are receiving some abuse of a different nature. And now we're looking into the detail of that. And we'll be doing whatever we can with regard to working with those service users and supporting members of staff um, to change the position on that. Um, we've very much over the last 12 months looked at systems and improving systems. So we're not collecting the right data at the moment, but um, it was meant to be by the end of March we were rolling out a new Access HR system. It'll be rolled out to some parts of the organisation by then, but it'll be rolled out, it'll be a few months later, it'll be across the organisation, and we'll be able to capture the demographics then, and that will really help us so we can target employment and where we need to in the areas where we need to drive up employment. I suppose another thing that we haven't focused on as much is equity. So we've always asked the standard questions about equality of opportunity when we've recruited staff. But certainly through the training that was commissioned by the applied research collaboration. It allowed all the managers across the organisation to understand equity. Some came into the room with knowledge, some didn't. But now we know that everybody that was in the room and everybody at managerial level understands what equity is, which is so important because everybody's not starting at the same place. Um, Often there were investigations, and it was quite clear that there was just such a lack of knowledge around equity, and statements were being made which were offensive, but people making those statements weren't doing it out from a bad place. They were doing it without the lack of knowledge. So there's whatever training's been provided, um, it's been accepted and understood, and I think we're just in a better place for that.
It sounds like you've been doing so much work, and yes, things take longer, but that doesn't mean we can't do them and we shouldn't keep at it. There's a reason why they take longer. So, I think it's okay to think things through and do them the right way if that means they take longer. But I have so many questions I want to ask you now about everything you've been saying. So, obviously there's been change and there's been work in place, but the minute you decided there's work that we need to be doing here, was that more coming, I guess, from the perspective of we identified a problem and we need to solve it, like you were saying, we have stuff facing discrimination, we need to solve it? Or was it more so there's a goal, this is what we want to look like as an organization in X amount of years, how do we achieve that? And then that included the work that you've been doing.
The honest answer is, being given that sort of equality lead, I felt that, right, I really need to pick up the mantle. I need to understand what is required to be an equality lead. And the way that I go about that is always to get out and learn and talk to people. And so where I met you at the conference that I attended in the Northwest, it was a learning opportunity for me. And I remember that morning thinking, can I afford the time to be going to this conference? Because I had a lot of other work pressures as usual. But I came away and thought that's probably been one of the most valuable things that I've done since becoming CEO of Imagine. Um, and, I heard about the work that was going on within mental health trusts, that was going on within charities, the ways that leaders were really leading the way and improving services for people using them and improving the work cultures. And from then, I was sort of a bit of a woman on a mission, really, and came back and thought, well, the next thing to do, I felt, was to try and get a working party, because I realised just how much work there was to do. And didn't really know where to start. Um, and got a working party together of members of staff across Imagine at all different levels, who feel that this is a really important piece of work. Um, so that's so helpful. And they've been working with me, with the consultant, um, and you know there were so many questions that they were asking and I was thinking about, and we were saying, well, how does it feel at Imagine, to work at Imagine if you have a disability, if you're from a different racial background, how does it feel? And none of us knew because we hadn't done an equality survey, a wellbeing survey at Imagine. And that, we should have been doing that. So by doing that now, it's really helped us to be able to get some actions in place. And I've also put myself on a course. So, I'm on a course now, which is it's for leaders in the Liverpool City region, and it is about racism. And I've learned an awful lot about that. One of the big things that I've learned out of the last session was, how you challenge racism, the right things to say, to get people really just to stop and think. Um, I've been using some of that, and I feel like I'm growing and developing as a person. Apart from in my role at work, just as a person, living in my community with my circle of friends, it's made me challenge more in the right way, always to try and bring people on board to improve their knowledge. I always come from a starting place that, you know, um, it's no good saying we're an organisation that doesn't stand for, we're zero tolerance.
Mhm.
If we say we're zero tolerance and then we lose staff because we take a hard line, but we don't put all that training and investment in, we're losing good quality people that are just short of some knowledge and time. If after all that's been invested, into individuals, they still take a line which is not true to our values, then they're wrong for Imagine. But certainly through my own self-development, I just know how much you can benefit from some really good quality training.
Absolutely. And if we're talking about inclusiveness, we need to give people a chance first, don't we, before we judge them or say you're not good enough for the job. Absolutely. So
Yeah.
it sounds like you came to the role of equity, equalities lead, and from that everything was triggered. So there's a link between that personal journey of training and understanding what it is you're supposed to be doing at bringing it at a team level where you brought together colleagues across the organization and at different levels to work on this with you, and then that impacting the wider organizational culture, I guess.
Yeah.
So
Yeah.
do you see those levels, I guess, how do you see those levels interact as well? Is it more kind of a the team is deciding and whatever comes out of it everybody has to follow, or is there more of a, although it's a team leading, is there more of a co-production going on there, or is there more where as the awareness is raised across the organization, how, I guess, how does that personal team organizational level interact?
Um, there's a lot of sharing and a lot of
Mm,
trust within the group, and a lot of thinking, and ideas coming from it. There's nothing that's discounted. Um, it, it really is, a very equalised group. It doesn't really matter what role anybody has within the organisation. And I suppose that's the way I lead, really.
mm,
Um, we've got quite a hierarchical structure within Imagine, and layers of management, which, sort of medium to large size organizations have that type of structure just to help with who's accountable for what and whose role is what. So there's that clarity within there. But very much the way that things have evolved at Imagine is that um, pieces of work are done across the organisation, and this is one of those pieces of work where, by including members of staff that are sort of champions in equality, um, they will go back to their services and share information. And they have relationships with their colleagues and will be listened to and valued. Um, and what we need to do is just um, spread really the knowledge, um, and they also talk to their teams, and their teams will make suggestions which will flow back into that group.
mm.
So we're getting the best of both worlds really, because there's so many things that are being suggested. For example, our calendars, to celebrate diversity within our calendars, to have communication events where we share diversity. And it's not, some of that hasn't come from the group, it's come from group members who've discussed it when they've gone back to their services. So we had an event over at Fielder Lodge, where the applied research collaboration came along, and we did the come play with me events. But also we also at that meeting, some of the staff chose to dress in their traditional dress. And the food was their traditional food, and they were just talking about their cultures, their religion, and doing it in a very, very relaxed way. So, so yeah, the ideas have come from the group, and it being cross-cutting, it's gone far and wide. And some of the suggestions, of bringing in the applied research collaboration to do the come play with me events, they were done across the organisation in the 3 geographical areas. So what we had is, the working party helped to organise those, and then we had service users who could benefit from playing the games and just coming along and, enjoying the music and seeing the costumes and learning in that subtle way. So it's very difficult to imagine for frontline workers to be able to come away from their day job to attend a training session, but by delivering the sessions within the workplaces, staff were able to attend alongside people that we support. And therefore everybody benefited, you know. So it's trying to think about doing it. And we all learn so in different ways anyway. And that was the most
Exactly.
natural way to do things. So I think it's been successful. And also there's the accountability of that group as well. So the ultimate accountability will sit with me around the strategic direction of you know, how we deal with equality across the organisation. But now I know I've got each member of that group feeling responsible for making sure in their work settings that they are equitable and inclusive.
Yes, it was so much fun, and I know the public advisors who joined me as well. We loved coming in and meeting everybody and playing our snakes and ladders and all the other games that we brought along. And as you say, it's what we've seen is that not everybody learns the same way. It doesn't always have to be like a strict academic setting. Here's 1,000 slides, let's learn all the theory there is out there. 'Cause sometimes people, I mean, not sometimes, always, people experience health inequalities. It's a lived experience thing. They may not have the, the academic language for it, but they absolutely know what we're talking about. So it might be more about helping them to think what they can do in terms of action taking rather than thinking this is too big, it's for the government to solve kind of thing that we often hear. But at the same time, I think the other thing we've seen is, like you're saying, there's learning theories and language is one thing, but actually changing attitudes, that's where the champions, that's where the personal relationships come in that are most effective rather than somebody external, coming in and doing a workshop. It takes more than that to get people to trust and see the benefit of doing something to then put in their energy of learning whatever it is they need to be learning or changing their practices. So I guess I'm wondering about the team that you brought together to work with you on this, and it's amazing if the accountability is now shared. So I'm very interested in that journey. So when you brought them together and you said, "Here, come in, let's do this together," did you have to look at convincing them about it, changing their attitudes, or were these people that were already on the same page with you?
Um, I did have a word in certain people's ears who I'd met. You know, some attended the training event that you facilitated for us. I was certainly sitting on a table in a group with a couple of members that I invited to join. Everybody was invited to join the working party. So the usual way, you know, an email was sent out saying why this piece of work was important and calling for people to join across the organisation. So that was one thing, and some people joined through that way. But then I knew that there was people on that table that day that were really committed to improving inclusive, can't say it, across Imagine, to making Imagine more
Yeah.
inclusive. So I actually went along and I spoke to them and I asked them, would they be willing to join the working party? And we looked at how they could join and who could backfill for them in services for them to come out and attend. We spent a little bit of time actually just thinking about how much time would be required and what was the best way of holding the meetings. Did they need to be in person or could they be facilitated online? Because one of the big difficulties we've got is that people are on shifts, you know, staff are working shifts, they're in services, and there's difficulties finding cover. So it was agreed amongst the whole team that it would be better if we did them online, and that's what we've been doing. And there's been a high attendance, you know, even we've had one occasion where someone was off and she joined for the couple of hours.
That's commitment.
So she obviously thought that it was worth doing that. Um, and time goes into to planning the meetings. Um, Definitely anybody that puts anything forward is read, is shared. Um, Only today we've got the survey. The first sort of part of that well-being survey, and that will be shared with the equality group before the next stage, which will be when it's worked on further, and then it will be sent out to everybody that works for Imagine Independence. So yeah, they're a trusted group. They're a group where we can share the information because some of it is sensitive,
Sure.
you know. But no, there's that trust that's been developed where there's not a second thought to say, no, send that out to the Equality Working Party, the EDI Working Party, for them to look at the information.
Absolutely. And it's one thing sharing sensitive information, and another, because it's sensitive, trying to ignore it or not do anything about it, which doesn't really take us anywhere, is there? So it's how you do things rather than do versus not do them at all.
Yeah, and we had a low uptake, which we were very disappointed with. It was only about 22%, but I've just sent out a message today across the organisation because the also some staff weren't keen to share the demographics,
Hmm.
so I've put some wording in there to say that we don't need it to identify individuals, but what we need it for, and it is to try and change things for the better. And I've also, you know, some of the um, initial findings are around how staff feel about their pay, their wages. So it's about, we've listened to this, and this is what we are doing about that. Um, and there's also about some service users and sort of some harassment issues, um, which, once again, we're saying we're trying to look at that within areas and make sure staff feel really supported, and action is taken to work with service users to move them from the place that they are, and maybe bring in some specialist trainers to look at some of the behaviours, such as we're doing some really good work in one part of the organisation with positive behavioural support
Hmm.
and having some positive role models to work with a woman, and that's working quite well. So there may be some more of that can be replicated in other parts of the organisation. I think it's really important that anybody who has completed the survey and has been honest knows that we have heard what they've got to say, and we are going to take action.
Yeah, yeah. But it sounds as well that, whilst you're surveying and measuring and taking stock of things, you are also already taking some action towards things where you can see the whole picture and decide what to do about it. I guess when we think about this equity journey of many either individuals or organizations, it starts with awareness raising, training, and then taking action. But sometimes we stay at that raising awareness, understanding, and keep short of taking action. So for you as an organization, was there a point when a decision was made that, okay, we understand enough, now we need to turn things into specific actions? Was there something particular that triggered that maybe would be helpful for others to understand how that happened for you as well?
Um, it was just so natural. It was,
Mm.
once we became more aware. Um, the next step was obviously to do the survey,
Hmm.
um, and to find out. So, for example, let's look at career development opportunities. That was one thing that came out of the learning and development, about um, you know, people from different racial backgrounds, and people with disability in general, how difficult it is for them to secure employment and career development, and hearing um, people saying, it is 10 times more difficult for me, or it may never happen for me, or I've been in a job for 20 years and other people have been promoted around me, and I never have. And some of that has come out of the course, the leadership course that I've been on myself. Um, and certainly I came back and I've been sharing some of the learning from that, and then um, as a leader, doing what I can do across the organisation to change that. So we've done a bit around that. We've introduced some trainee senior support worker posts
Hmm.
in our women's service. So I went in because we had some problems, and we were losing staff, and I thought I'd really like to know why myself.
Mm.
So I went in and just said, if anybody would like to speak to me, I'm here. And I ended up going in 3 times and speaking to about 90% of staff who came forward and told me what it was like working within that service. And I came across so many um, really strong support workers. And I asked a number of them why they hadn't put themselves forward for senior support worker posts. And some of them said to me, well, I've never considered myself to be able to take that next step. And I validated for them the fact that they had all this skill and experience. And really, I encouraged them to apply for some of these vacant posts, which had led me to go there in the first place, because there was like a lack of leadership at that lower level, because they'd been vacant for a while. And then I spoke to the manager there and said, you've got some real strong candidates, and why haven't they been applying? Or if they have, why haven't they been successful?
Mhm.
And we had a conversation about equity, and we had a conversation about what we could do to put a program in place to help um, 2 members of the team well, it was as many people within the team who wanted to apply to step up. Anyway, we put that together, that program that someone could go in, the support, and identified what we could put into place. And we filled both positions. And I've been back recently to the service, and I've witnessed being on shift with both of those member of staff that were leading the shifts, doing a brilliant job. So, in a nutshell, I suppose, by me just sharing the learning and then saying, hang on, can we do something here? Yesterday, I had another director who came to me and said, could we do a trainee manager post in my service? So we're looking at the possibility of making that happen as well. But by raising awareness, it's no good just knowing and not doing. If you know, you're compelled to do. And everyone, imagine, feels the same way, within the executive management team and within the equality working party. It's what next is always the question. Okay, so we know. So what can we do to improve that? What can we do now? So
Perfect.
we've got quite a list of things that we're going to do now.
That's fantastic. And with your list, like in terms of implementing change then across the organization, how do you go about that? Is it that you write up plan of action, big strategy, or tackle things one by one as they come about? How do you go about that?
I suppose it depends. It depends really what what they are. There's some short term um, things that we can do quickly, and there's some long term pieces of work. And on the training that you facilitated for us in the afternoon, we drew up some quick wins, some things we could do immediately, and some longer term aims and aspirations. So we've been working through some of those quick things we can do quickly and put them into place quickly, because we're talking about improving people's experience within the workplace and experience of being supported by Imagine. So the sooner we can do it, the things without the red tape we want to do quickly. And then those longer pieces of work, they do take more time. Um, they absolutely do take more time to do because they need to be done well. Um, but they're up. and going. So if we talk about recruitment and selection, so we've reviewed our recruitment and selection policy, and we've looked within that about positive statements, the whole journey from when somebody applies, the adverts we put out to people applying, um, to interview, to after interview support, and to induction, um, to the whole journey has been looked at. So it's taken time, um, but there's pieces of work being completed, and when it is rolled out, it'll do what it needs to do, because it's okay putting a statement out which says we're inclusive and please apply to Imagine. And then, somebody implies, for example, with a physical disability, and then we think, actually, they can't work in that role because they need aids and adaptations. And we haven't, if it's an admin role, we can put that in place. But if it's a support worker job, then, if somebody's got mobility issues, some of our buildings, they would not be able to work in. So now we're a lot more conscious of before we say, please apply, thinking, well, how are we going to make that
Yeah.
happen if we do get those applications? So it's a lot more considered, which is how it needs to be.
Yeah, it's saying things, but then practicing what we preach. To do that, we need to really understand what things we're claiming and we're saying mean in practice, right? It's not
Yeah,
enough to just put labels, as you say, we're inclusive, come in, but then what does that mean in practice? How do we do that?
yeah.
Absolutely. And so it's all work in progress. I get that. I assume that you'd envision at some point getting to kind of, I don't know, a set of agreed standards that everybody adheres to 100%, where this aim of improving health equity is shared across the organization 100% and is visible for everyone to see. What do you think it will take to get to that stage?
Um, it takes one of the things, I mean, reviewing policies, procedures, strengthening them, strengthening processes is part of it. But it's more than that.
Hmm.
It's actually having the leaders within the organization, and the managers within the organization really wanting to make this change, really all believing that this needs to happen. Um, so we can do all the strengthening the policies, the strategies. We can, continue with awareness raising, improving the training, and that is a way to definitely get people on board. It's also capturing the evidence of and sharing that, capturing things that are going well. I believe in keeping the workforce positive. There's a lot to do for everybody in every role. Um, and some of it is carrot and stick, isn't it?
Hmm.
But I think definitely by saying, look at this example of a piece of work that's being done so well, and look at the benefits of it. So wherever we can to get good news stories out there, that our workforce can read and be proud of, and feel good about the work that is being done, because it is a journey, and it's a journey that's going to take a long time, and it's consistent effort with every new person that joins the organization, um, and to keep everybody that's already in the organization working to the right values and thinking the right way. Um, but yeah, I do feel doing a number of things that then become quite natural. So, the calendar, you open your calendar up and we're celebrating other cultural events rather than Christian events. That, you open the newsletter and we're celebrating diversity within the newsletter. You open the newsletter and you're looking about people we support and with disabilities and what they're achieving.
Mm.
Um, and that makes you feel good and it makes you actually think, I want to do some of that. I want some of that. And within my service, I want us um, to make it better than what it is. I think the demographics will help as well massively. Because we can share those and maybe say, look, we're not doing so well in this area within this service. Can we have a plan to improve what we're doing here and what can you do? And get those local teams to think about how they can improve things for their workforce, for people that they support. Um, so yeah, they're just a few things that we can do.
So you were saying something about capturing the positive events and celebrating and the evidence of how good things are going and sharing that across the board, which made me think, we were talking about before about awareness raising and then developing knowledge of what this means before being able to go into action. How is that knowledge shared and communicated across Imagine, or maybe even stored? Because I'm thinking also in the voluntary sector, but I guess in the health and care sector across the board, staff turnaround is a real challenge. So how do we carry that forward and share it between staff members and service users across the organization? So how is it shared? How is it stored? And where you don't get to a point where you feel you have to start over again.
Mm. Let's see. Induction is a good place
Mm,
where information is passed across, particularly about values, about um, equity. There's a session on that within there. Um, we're keeping it live through the ways that I've mentioned. Capturing the learning is um, is something that we probably need to do better. Um, so we certainly share all of the slides are shared after any training, through the organisation. Um, Team meetings are a good place to share. They definitely are. So we probably need to do a bit more around, discussing,
mm,
post discussion after training, sharing the learning, maybe sharing some of the resources, sharing some of the materials with staff teams. Because as you say, there is a turnover of staff and new people are joining teams.
mm,
Um, and quite quickly, if we are losing staff, you end up with not enough knowledge within the team. So there is something about that, making sure that one, that we retrain, but and share the learning. But the other thing is we've got to, as an organisation, um, do what as much as we can to retain staff.
mm,
Um, and some of that is about the support structures that we put in place, the reflective practice that we put in place, um, the training,
mm,
um, and some of it is about pay,
mm,
and that's just come through in the wellbeing survey that staff feel undervalued because of the pay
mm,
that they're awarded. Um, so we have got a meeting actually scheduled for this week with another provider who's looking at terms and conditions, and they've managed to get all of the frontline workers on the real living wage. So, so that's one of the things we're looking at doing. Another thing we're doing is we're going back to commissioners and challenging commissioners really and saying we're having difficulties recruiting within this service because of, is there any way that, you can do something here? Um, we'll be looking at what we do with the inflationary uplift to try and retain staff in services where we know it's particularly challenging.
mm.
So yeah, there's one way which is retaining the knowledge, but the other thing is retaining the staff.
Yeah.
that have got the knowledge. So yeah, it's double pronged what we need to
Yeah.
do.
And so that's incentives to keep the staff. Do you think there are any incentives that you found are particularly effective in terms of encouraging them to share that knowledge, to contribute to that knowledge that is being built over time?
Well, I mean, the working party is a good way because obviously there's an awful lot of information that is being shared with that team, and also they've got the opportunity to work with the EDI consultant as well, who's got sort of yards of experience of you know, in that field that she leads on really. Um, so yeah, those staff have been really invested in. They've put their time in, but they're getting a lot of investment back in regarding their personal development and career development. We need to. I mean, there's been some opportunities for staff to attend the sessions that the applied research collaboration have applied, have provided for us, the management training session. Um, and we're also always reviewing what we do in e-learning, and seeing if there's other modules that can be added on, and looking at the budget. Um, I'd certainly like to look at champions going forward, that we can invest in some equality champions in within the different geographical areas. I think that's a way forward.
And I mean, throughout we've been talking about this journey and this interaction between kind of personal, team, organizational levels. Do you see that all as an internal process to the organization, or is there a role and how do you go about it with communicating that with other stakeholders or with other partners in the wider voluntary sector, health and care sector?
Yeah, there is a role. Definitely, there's a role with other providers, and I know that our providers are competitors, but I put that completely to one side with regard to equality and other issues that are much wider issues, um, and definitely share information, um, share resources. Um, this is something that is bigger than our organization. This is about communities. This is about how we live, how society, um, we all need to do whatever we can. We have to now more than ever, uh, to work together, to work, you know, and to work with people where there's an open door, where they're on the same page as us, um, that they can sort of use some of what we share to influence their workforces, and they'll go home and they'll influence their families and their friends, and that it's a ripple effect, of what we share, the knowledge we share. So there's lots of opportunities with providers for me to do that. There's lots of collaborations that I attend. Um, you know, um, Working with like-minded providers is so beneficial, because we learn and they learn and we share information and they share information. And this is just so important. Wherever we can influence, we need to be influencing.
Absolutely. What would collaboration be without sharing, right? What's the point?
Yeah.
And you mentioned something at the very beginning, which I've kept in the back of my mind this whole time. So there's a question about, are we doing things right? And then there's the other part to that, are we doing the right things? And it sounds like your organization had, and people within the organization have been able to raise both questions as and when needed. I know that's not the case for all organizations out there. So how do you think can individual organizations kind of encourage asking of both these type of questions? So are we doing things right? Is it something that we need to be doing more or slightly different? But also, are we even doing the right things, or should we need to be changing and refining strategy or overall what it is we're doing?
I mean, it's hard to get a start in place, isn't it, with this piece of work.
Mhm.
And you're always picking up from where you are anyway. But it is hard to know where to start. Um, and you know, I think a starting place is always to ask, um, and find out and hear what is on offer. And you always learn, you always learn from something. You can go in and think, well,
Mhm.
I think I know a little bit about this. I don't know how much I'll benefit from it, but you will, you know, and the other thing is, I think the biggest challenge for us all is, how do you actually get people to think seriously about these subjects and change their way of thinking and their behaviours to become more inclusive? Um, so the starting point is really getting people to into a discussion of where they feel that they can be honest, and they're in a place where they can trust each other, um, and not be judged.
Mhm.
Um, I think you can't work with anybody who's so hard and fast they've made their minds up and that's it, you know. Um, so I think for any organisation, it's to try and find out more. It's to use the resources that are there available, um, to to put it high up on your agenda. It's one of the most important things. To put it really high up on your agenda, and to use any resource you possibly can, um, to give your staff the opportunity to expand their knowledge. I don't know if I've answered the question
Yeah, yeah,
well
absolutely.
enough.
I guess I'm just thinking what others might think hearing of this is that in your case, because you came in the role of CEO, putting things on the agenda and deciding this is what we need to talk about and making the room feel comfortable talk about this. Is this the only way to go? Does this always have to come from senior management?
No, not at all. I mean, we've tried to open up communication avenues, really, I imagine. So we've got freedom to speak up, where a lot of our workforce do um, put comments in, concerns that they have, and that everything is looked at, is heard and responded to. So I think the more that staff have used it and know that it's responded to, they think this is a place where we can share and share, anonymously, or in a protected way, share what they say. Um, Certainly, we've opened up. Well, communication's always been there you know, within team meetings. But there's definitely the opportunity within team meetings to put, equity and equality onto the agenda. So at that level, we've improved some of the communication from to EMT. When I talked about our structure, um, you would think that the levels of management, it'd be pretty top down. The information's going that way, but the information's coming up the other way as well. So we have heads of service meetings, so be with EMT, and a lot of the agenda items. I mean, pay's been on there, so support workers have said, I want you to go back to EMT and say, what are they doing about pay? So certainly it can filter up issues about equity, equality, it has worked recently about a service where there's been there's been a lot of racism within that service.
Mhm.
That filtered right up. It came from the team meeting, it came up and ended up at director level. And so there is that two ways of getting information up there. There's an anonymous phone line, there's a grievance policy, and they're all used. So there's many ways. And the grievance policy starts at, you talk to your manager if you're feeling aggrieved about anything. It doesn't go to stage three. Sometimes it never gets there.
Mhm.
It's discussed at the basic level, and then it's dealt with there, resolved and sorted. So um, we've done a lot to try and improve communications to get information, and to deal with, what a person can do themselves. If they say this doesn't feel right, the culture doesn't feel right within the service that I'm working within. I've had grievances that have gone to the highest stage about that, but also I know that issues have been dealt with at team leader level. Um, so there's always more we can do, Katrina. We can always look at making sure that supervision notes, for example, I've got the right headings on them where people can feel free on a one-to-one in a protected space to bring up issues that they're facing. It was a really good question, and it's probably one that I need to put out to the workforce.
Thank you, Elaine, and it's great to hear your journey, and it's been an honor and it's been an absolute pleasure to be a part of that to the extent that we have been. But obviously, your personal or the organization journey is much larger than the role that we've played. So it's great to also for me to step back and actually hear about how things have been developing. And as you know, we're recording our chat today as part of our health equity mainstreaming strategy evaluation, which is the strategy we've had in the ARC trying to help organisations across the Northwest Coast region of England to kind of mainstream equity and equity sensitive research and how we get there. So, and it's not easy, it's not straightforward. Like you were saying before, you have to work on also hearing things that might not be nice to hear in the first instance, but then always keeping that idea in forefront. What's next? Right, we understood, we did, we measured. Now what do we do in action? How do we actually change things around and change hearts and minds, like the health equity research advocates would say? And that's maybe something to talk to you about afterwards when you talk about champions. That might be a group to get your champions in. But coming to an end of this, is there anything else you would like to share, either from your personal experience, from the organization's journey, that you think might be useful for others trying to bring about change more widely and more specifically trying to mainstream equity? So any steep learning curves maybe that we can help people get ahead with, or any top tips from what you have been doing?
I think one of the most impactful things that we have done was bringing in the applied research collaboration to the sites. Doing the Come Play With Me game, and the other games, and staff having the conversations with uh, the public health officers that attended. Um, because sometimes with the labelling of health equity, there were members of staff that sort of thought, well, I don't really know about that. I'm sure if we asked some people we supported, they would have been a bit lost to define what it was. But playing the games, and straight away you got it because the examples were so real. So I think people came away feeling they did have knowledge. They really did. And it just confirmed that to them. Um, you know, and it was thought provoking, and that's what we all need to do. Just think a bit more. Just think a bit more and behave differently where we need to. Be conscious of what's going on in the world around us. So it was, and I also think having the opportunity to get people that use our services to attend. It benefited them and they really enjoyed it. And some of the feedback was, from them saying they loved the get-togethers. They just loved it. And staff had the opportunity to grow and develop. So it was a good way to raise awareness and get our frontline workers, give them the opportunity to attend the events.
And just to say, I've not told you to say that. This wasn't
No,
agreed. So
not at
thank you
all.
for saying that. But also to clarify, I guess what you're saying is that what was helpful is meeting people where they're at with their learning
Yeah,
and taking them along and prioritizing lived experience over academic big theories, which we talk about in academia, but I think we don't play the game enough. And so it's something others can replicate and do in their own ways. I think there's lots of great ideas out there. It's just actually putting them in place and sharing that knowledge across the board and sharing the games and making it all an experience, because I guess once people connect with something emotionally, they learn. Otherwise, it's something on the side of their ear that they'll forget
yeah,
after a while, isn't it? And it's
yeah,
not new information that we've not held for decades now that we're coming in with. It's more so, right, we have this information, we know you have it too, whatever you may be calling it, but what are we going to do about it? Let's talk about that. And that's not something any of us has all the answers to. As you were saying, is about bringing heads together in that up and down, if it's hierarchical, or across the board, if it's with other stakeholders, sharing that information and that thinking of what is it we can possibly do, and trying and failing sometimes.
yeah,
But again, being transparent about it and understanding why did it fail? Why do we need to do things different? What else do we need to bring in? If we need to bring in expertise, great. But then let's put things in practice and share that.
yeah.
It's been so insightful. I've loved hearing about all your journey, and I'm sure others will find it helpful as well. Because we tend to publish and say, we went from A to Z and it was all a straight line and it was all
No,
straightforward and brilliant, but it's those challenges that we need to talk more about and help each other understand what it is we mean by things in practice, and how do we go about things, or how others have gone about it, so that they can replicate as and when needed. So thank you so much, Elaine, for your time and for so kindly being open and sharing all your insights. Thank you.
okay. Thank you, Katrina. Thank you.
Yeah, check it, health equity, that's the bottom line. Not just access, but a fairer design. See the social determinants, the zip code's weight, systemic disparities that seal a person's fate. We build community well-being, block by block, break the cycle of the disparities around the clock. For every single person a chance to be well, yeah, for every single person a chance to be well.